You see, if you or somebody you love has a serious illness, is living with a serious disease, I hope they're being cared for in a health system transformed by an initiative like the Personal Caring Initiative. Mindy, a well-known social worker, 47 years old, came to me in my clinic back in 2007. She said, "You don't know this about me, but I want you to take care of me for the rest of my life. I have stage 4 ovarian cancer." And when she said me, she meant all of her. She meant, how am I going to die? Do I get more treatment? Do you have a way to stop the nausea? And by the way, how about the pain? Can we treat that? She asked, she said, how is my husband going to cope with this? And how's he going to be when I'm gone? And oh, by the way, my mother, she would trade places with me in a heartbeat. How about her? You know, I don't want to be a burden on these people that I love. You'll recognize that what was important to Mindy was not the biology of disease, but rather it was the lived experience. I did my best, and frankly, my best wasn't good enough. You see, medical school, residency, fellowship, they don't really train you and teach you to respond to the personal problems and the difficult symptoms that patients and families deal with. My training was only part of it. Our disease treatment system, and notice I didn't say healthcare system. It's been designed and reimbursed to perform procedures, prescribe medications, and get people through as quickly as possible. Our system isn't designed to provide a professional team to care for people like Mindy. You see, Mindy needed a personally tailored approach to her care, and I was inadequately prepared to deliver that in 3 main ways. Firstly, I didn't have the skill to provide the best care possible to treat her relentless symptoms and deal with her and her family's spiritual and emotional well-being. I was also in the wrong role, fitting her in between well child visits, adult physicals, high blood pressure checks, and ingrown toenails. I needed to dedicate. I also didn't have the time. You know, our system, our healthcare system, my practice model, didn't afford me the time it took to care for somebody like Mindy. You see, I didn't have the skill, role, or time. And Mindy felt it. Mindy received disjointed, uncoordinated, substandard assessment and treatment, and I personally lived with the moral distress, knowing that our system wasn't good enough to care for Mindy. You see, serious illness is different these days. It used to be you got a serious diagnosis and you died, a week later. The time now between diagnosis and end of life is a long time. So people are living longer with multiple diagnoses. And for every diagnosis, there's a treatment. Thank God there is. We augment this with attention to symptoms, counseling, and coordination of care. You have to ask the question, how is it possible for somebody like Mindy, living with decreasing function, increasing symptoms, and approaching end of life, how is it possible to have increasing quality of life? That's healing, folks. After an additional year of fellowship, and since 2010, we've been working on transforming care for our most seriously ill community members. And Vickie was one of our first patients. And just like Mindy, she was living with stage 4 ovarian cancer.
Suffering from some conditions, and they immediately, because of their vast experience with people going through those types of situations, said, we need to do this, 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 and this for you. And that aided her tremendously. It took her out of a lot of pain. A lot of the symptoms which were causing her a lot of problems were remedied within 1 or 2 days. And I was amazed how intuitive they were to what my parents were going through, what Vickie was going through, what we were going through. And my dad had really struggled with Vickie's situation, and it really helped him. When he came out of that meeting, he says, wow, they're wonderful.
So my moral distress has been largely lifted because we have a dedicated health system, community initiatives, and a palliative care team that provides expert symptom management, coordination of care, and supportive counseling like never before.
And this was right before my sister's son was getting married, a week before he was getting married. And they had said all along, we will get you to that wedding. And I would never have dreamed they could accomplish that goal. And they did. And she looked gorgeous. And it was in large part thanks to the love and care and support that they gave her.
Thank you.